So we have a story here. Fit and healthy dad who didn't get COVID-19 jab needed double lung transplant. So this is the guy here, and he was in supposedly great health. The 50-year-old is the first patient to receive a double transplant for complications arising from the coronavirus. He caught it just before Christmas last year and would have expected to recover quickly as he had no underlying health conditions. He also was unvaccinated. Okay, but they brought him in, and this sounds like this was, the one in a freaking million case, where he comes in and he went from inflammation of the lungs to lung fibrosis, scarring of the lung tissue. He was unable to breathe on his own. He was kept alive by machinery, and then ultimately he was able to get a double lung transplant. He said it was a very frightening experience. I didn't know if I would ever leave the hospital, and I can absolutely imagine that that's true. I can't imagine what it would be like to have your lungs scar up and be unable to breathe and be reliant upon getting a transplant. That would be a horrific experience. Horrific. So he talks, though, they all treated me with the most respect, professionalism, and compassion. They made sure to support me physically and emotionally during my lowest and most vulnerable times. I can't thank them enough for taking care of me. My donor gave me the gift of life with their selfless decision to be an organ donor. This guy hopes to gradually return to his work as a maintenance engineer at a 5-star hotel in the capital. For now, he's spending time with his family. The Professor John Dunning, Director of Heart and Lung Transplantation at Harefield Hospital, said, Caesar was fortunate because he was able to receive a transplant. We've seen a decrease in organ donors since the beginning of the pandemic, and as a result, many patients on transplant lists are not living long enough to receive an organ. Okay, now this is obviously from the UK, this story. Okay. Now, this is very much a happy ending. Okay? Very much a happy ending, and all the best wishes to this guy. I hope the transplant is very successful and he goes on to live a, tremendously wonderful life. But now what we need to do is contrast this with what is happening in Canada. So we're going to come over and we're going to take a look at this. So recently, as in today, petition drop-off. Will a Montreal hospital let a patient die just over a vaccine? Okay, so here she is. I can't believe they'd really refuse me over a vaccine. So this woman here was on the donor list, meaning she was on a list to receive transplant for lungs. I believe it is actually lungs, from a donor because she needs them or she will die. However, as we come to 38 seconds, my cystic fibrosis specialist asked the transplant team in June to come back and see me, and they said as long as she isn't vaccinated, we won't go see her. So she is now, effectively, she has been removed from the list of people who can receive organs. So we have a situation now with this woman where she lives in Canada. There is no two-tier, and by two-tier I mean there's no public and private healthcare. There is a public healthcare system that she, her family, her loved ones, me, and everybody else pays into through their taxes. It is publicly funded. Okay? But they won't go and treat this woman who has paid for the system, her family who has paid for the system, her friends, her loved ones have paid for the system. And now they're denying her the ability to access that system simply because she isn't vaccinated. That is appalling. It is unconscionable. And frankly, it should be illegal. Because as a tax-paying citizen, my money is in this system. And you know what I say? I say, get this woman her transplant. She deserves it. She needs it or she will die. To remove her from the list is absolutely evil. Okay? Now we're going to move on, and we're going to go further into this, and we're going to come up to about 6 minutes and 30 seconds. And here's part of the problem. Okay, we're going to go over two parts of this problem. So now, here's this guy, and they're asking, what do you think, right? This reporter is doing sort of a man-on-the-street interviews. What do you think about this woman being allowed to die because she didn't get vaccinated? Okay? He says, this is a personal matter, but I can understand the urgency of the situation. I'm sure they have good reasons other than vaccination as well. Now, I don't know if he means they being the doctors and the governmental organizations, or they being the woman who has not been vaccinated. I'm assuming it's the former because he says other than the vaccination, implying that the doctors have some reason why they would not be doing it. I think that if you want to be treated, you have to agree to be vaccinated. So, in other words, to access the public healthcare system that everybody is required to pay into through their taxes. It's not something that we then voluntarily say, oh yeah, I want to be part of the public healthcare system, so I'm going to pay, I'm going to tick a box, and you can take off extra taxes from my check. No, no, no. They're out of there. They are taking that money no matter what. So you have to pay into this. But this guy says if you want to then be the beneficiary of that system, you effectively have to do what the government tells you. Well, that's a very dangerous situation to be in. We come here now to about 7:30. And this is taking very long to load up. Here we go. So we have this other guy. She's not vaccinated, is she? Yep, I think it's a bit, she should get vaccinated. Okay? Who the hell are you to tell her what she should do if she wants to get access to medical care? I'm sorry, should she have the right to make dictates on you so that if you get some kind of health issue, you have to meet her standards to get access to that health care? That's ridiculous. Of course it's ridiculous. And in fact, for these guys here that are saying this, I wonder if they're okay with it, I'm assuming, because they're saying, yeah, you should get vaccinated. Vaccination is something that everybody should do, regardless of whether you agree with that or disagree with that, okay? How would this guy or the last guy like it if the government said, yeah, we've got a public healthcare system. It's the best in the world, and we're going to force you to pay for it, and it's going to be fantastic. Oh, but wait, you want to access that healthcare? Okay, great. You have to maintain a BMI of this. Okay, you want to access that healthcare system? You need to have a body fat percentage that is below 30. Okay? Oh, wait, you want to access the healthcare system? You need to show me proof that you are exercising at least an hour every day. I'm guessing they wouldn't be so cool with that. Okay? Whatever that mandate is, you can't demand people pay for a public system, then refuse to have any private system, and then say, if you want to access the public system, you must do what the government mandates. Okay, what if the government said, oh, we're only going to treat people because we've got problems with underpopulation, the birth rate is too low, we're only going to treat people who are minors, and once you become a major, you have to have 2 children. Okay, you have to be married and have 2 children before you are eligible, because we're going to do that so that we incentivize people getting married and having children, so that we can again push the population up and actually be able to support financially this system, the system of the public funded healthcare system. Again, is that correct? This, according to this guy and the previous guy, yeah, you should, because hey, that's what the government says you need to do. Well, this is all fine and dandy for you, you frickin' bozo, and the other guy, the other dope, okay? But stop and think for a moment. It's not just about this instance, okay? It is about the broader idea of what the policy is. What is the underlying impetus for that, okay? And in this case, it is saying the government gets to make the rules. The government gets to make the rules for who can actually access health care. That's ridiculous, because that can be taken in any direction. And it's very easy for people who say, oh yeah, everybody should get vaccinated, or oh yeah, everybody should do X, okay? And again, whether I think people should get vaccinated or not is irrelevant. It's the greater policy, okay? It's the greater idea behind it, okay? It's easy for this guy because he agrees with this. He agrees with this statement. But the moment it's something he doesn't agree with, he's not thinking, I'm going to be the one getting screwed when I need a heart transplant, and I'm not having those 2 kids that the government mandates that I have. I'm not going to get a heart transplant. Okay? This is the danger, and this is what people need to stop and realize. When you've got a system like this and you've got people mandating things, they're willing to let this woman die simply because she didn't get vaccinated. They have no problem. Where's the compassion? Where's the understanding? Okay? Where's the we live in a free country? Where's the idea that she should be able to make her own life decisions? It's not there. And these people here are callous and they are heartless. Okay? They do not care about her life one bit. They only care that she makes the decision they think is important. Now, we're going to move on, and then I'm going to be done. But we're going to come to about 7 minutes and 9 seconds. Not this one. This woman here, okay? This is also a problem. This is why this is also a problem. We're going to start here, and we're going to read along. Okay? Oh, I doubt it's still in effect. The reporter says, yes, it's still in effect. She says, I'm really surprised. Reporter, what did you think of that? Well, I'm surprised. Reporter asks, do you agree or disagree? And she says, I'm having trouble believing that. And then, adios. Okay? And then away she goes. Do you think that woman is going to go home and look this up? Is she going to go back and she going to pull out, she even going to pull her phone out of her pocket or out of her purse and look it up and say, is this a real story? No, she walks away. She's saying, I don't believe it. I don't think the country would do that. I don't think doctors would do that. I don't think the healthcare system would do that. And then she's going to walk away thinking, yeah, the healthcare system would never do that. But this is the reality. The reality is the healthcare system is doing it, okay? And they're doing it to this woman here, right there, that real person, okay? She's living right now needing an organ transplant or she will die. Okay, I can't imagine the kind of fear that would put somebody under, how much stress that would put in their life, okay? I would be terrified if I was told I need a transplant or I'm going to die, okay? Forget any of this vaccination stuff. I'd just be like, oh my God, am I even going to get one? Is there going to be something on that list for me? I can't imagine what she's going through. And like I say, these people here, these dudes here, they couldn't freaking look at him. He's laughing it off. She's not vaccinated. Ha ha ha. Well, she kind of freaking deserves it then, right? And this other person here, she's like, sorry, I don't believe it. I don't believe it. Nah. It's not worth the effort of looking on my phone. It's not worth the effort freaking asking a little more questions about it. Forget it. Right? Unbelievable. And this is Canada, one of what was ostensibly a number of years ago, one of the greatest countries in the world. And now it's just a freaking, it's just another freaking piece of shit rat hole that doesn't give two craps about people that have a disagreement with the government, right? And in the pandemic, scamdemic, whatever you want to call it, from the last few years, has done nothing but bring to light just how much people in Canada do not care about their fellow man. Okay, they do not care about their fellow man. It's unbelievable.